Welcome to Module 4, Using Clinical Queries Filters in Pubmed. This is one of a series of instructional videos created for the Evidence-Based Practice Unit in First-Year Medicine. This series of modules has been developed by Tim Ruggles and Karen Neves from the Kellogg Library. They are the liaison librarians for the Faculty of Medicine. Let's return to our original PICO question in this module. In adult females with chronic low back pain, does tramadol with acetaminophen taken orally twice daily compared with placebo reduce pain scale scores? And here are our original search terms. This time we are going to run our search using the Clinical Queries page in Pubmed. From Pubmed's main page, click on Clinical Queries. This page is intended to help healthcare professionals find applicable clinical information quickly. There are 3 choices for searching on this page: search by clinical category, search for systematic reviews and meta-analyses, search for information on medical genetics. Let's look at the first search box. Listed here are the 4 main categories of clinical questions asked in patient care: therapy, diagnosis, etiology or harm, and prognosis. Pubmed has added a 5th category for helping you find clinical prediction guides. This will not be addressed here. For each category of question, there is a choice of searching broadly or narrowly. Let's look at the filter table to see how Pubmed will handle each search. Pubmed has built-in filters or hedges for each category, which use search terms created to find the best study designs for each type of question being asked. For example, the broad filter for a therapy question will find all clinical trials, whether or not they are randomized. The narrow filter under therapy is designed to retrieve only randomized control trials. The diagnosis filters use different sets of terms to retrieve high-quality studies to answer this type of question. Note that the randomized control trial design is rarely used to study diagnosis questions. These kinds of questions are generally studied using a cross-sectional design and look at a test's ability to find a target disease in a particular population called sensitivity, and to exclude those without the disease called specificity. The etiology or harm filter is designed to find cohort studies because it would be impossible or unethical to use the randomized control trial design for harm studies. Cohort studies are often the type of design used to locate prognosis papers as well. Your choice of using the broad or narrow versions of these filters depends on the amount of literature on the topic and how many studies you wish to review. Let's go back to the Clinical Queries page and run our search. Note the default settings on this page are for a therapy question with a narrow focus. Our search this time retrieves 15 citations. Even though we chose to search for only randomized control trials, the search did retrieve a Cochrane systematic review as well. In Module 5, we'll show you how to use the Cochrane Library.